Hey there everybody, welcome to HealthWell. Did you know that IBS affects between 10 to 15% of the world's population? IBS is a long-term chronic gastrointestinal disorder caused by problems with how the GI muscles contract and move food. It is caused by extra-sensitive GI nerves or a miscommunication between the brain nerves and the gut. An individual with IBS can experience many symptoms, the majority of them being painful. The ones that are not painful cause discomfort. It is therefore essential to listen to your gut too, not only your heart. And when your gut is aching, that usually means something is wrong. Irritable bowel syndrome is not considered a threat to our health, but the sooner we act, the more balanced our gut will be. That is why today, we are discussing 20 irritable bowel syndrome symptoms of which you should be aware. Make sure you stick around until symptom number 20. It's shocking. Number 1. Cramps. A cramp is a sudden and involuntary pain that results from your large intestine trying to push something through in the process of digestion. But it turns out it's not an easy job. Also called spasms, cramps are mainly caused by viruses, bacteria, or contaminated food. If you happen to experience many cramps, you are experiencing IBS and your gut is having digestive challenges. The most prevalent symptom in IBS is abdominal pain. Normally, your gut and brain collaborate to keep digestion under control. Hormones, nerves, and signals emitted by the healthy bacteria in your gut play a role in this. These cooperative signals get skewed in IBS, resulting in uncoordinated and unpleasant tension in the digestive tract muscles. Discomfort is most commonly felt in the lower abdomen or throughout the abdomen, while it is less common in the upper abdomen alone. Following a bowel movement, the pain usually subsides. Number 2. Bloating. Sometimes we walk around feeling like our stomach is swollen. It feels like we're about to pop like a balloon, and all we wish for is for whatever is inside to evacuate. Bloating is due to the retention of gas or fluid in most cases. Whether you swallow air from a straw, drink too much Coke, or eat too fast, your gut stores excess gas and struggles to process it. Number 3. Diarrhea. It is considered diarrhea when you have loose stools 3 or more times per day. That is directly linked to IBS. Viral infections often cause acute diarrhea. Many people have it a few times a year. It doesn't mean there is something serious you should attend to, but you can be sure it is due to IBS. In IBS, accelerated bowel transit can also cause a sudden, strong desire to go to the bathroom. Some patients report that this is a substantial source of worry and that they avoid certain social situations because they are afraid of a rapid onset of diarrhea. Number 4. Excessive flatulence. More commonly referred to as farting and embarrassing, it is a serious issue. Excessive wind can be uncontrollable and is mainly caused by swallowing too much air when we eat and drink. It is essential for us to take our time when we eat and make sure we do not inhale air when we put food in our mouths. That way, only the minimum required enters our stomach. Number 5. Constipation. Sometimes we can experience blockages in bowel movements, or just the feeling of an incomplete bowel movement, and those are signs of constipation. You can be sure that is the case if you don't have bowel movements at least 3 times a week. Constipation is a prevalent symptom and some people can experience it chronically, and that can make a person uncomfortable throughout daily activities. When constipation is happening with bloating, it is referred to as IBS-C. Number 6. Back pain. The connection between back pain and IBS is still unclear, but a few studies have shown that IBS pain can be transferred to our lower back. However, if the pain is due to inflammation, we are experiencing inflammatory bowel disease rather than IBS. In this case, a trip to the doctor is well advised. Number 7. Urgent uncontrollable bowel movements. There are numerous cases in which IBS can cause a bowel movement disorder. The person experiencing it has recurrent urgent bowel movements that they struggle to control. It is called fecal incontinence and is reported by 14 to 20% of IBS patients. Few studies have assessed the overlap between IBS and fecal incontinence, but still, it can be observed as a direct consequence of it. Number 8. Loss of bladder control. The loss of bladder control occurs with IBS as well. A sudden, generally unwanted, and uncontrollable need to pee can be caused by other reasons like stress or extreme fear. Still, it is something that happens with a vast majority of individuals with IBS. Number 9. Anemia. Anemia and IBS often go together. People with IBS do not profit from all the nutrients they eat. IBS is due to your large intestine not being able to fully absorb the nutrients in your food. Therefore, our red blood cells carry less than the needed amount of food to our organs, thus leaving a higher chance for someone with IBS to end up with anemia, for example. Number 10. Unexplained weight loss. If you are experiencing IBS and at the same time you notice yourself losing weight unexplainably, it might be time to see a doctor. Most symptoms of IBS are mainly due to digestion problems, causing a loss of the number of nutrients our body consumes. Having IBS for a period of time can result in weight loss since the body is not receiving all that it needs to stay balanced. If you are finding this video useful and interesting, please hit the like button for the YouTube algorithm. It motivates us to produce high-quality content for you every week. Number 11. Food intolerance. A vast majority of individuals with IBS report that they would rather avoid certain foods than trigger symptoms. The reason why certain foods trigger IBS is still unclear, but it is commonly acknowledged that certain types of foods like beans, lentils, and broccoli contain gas and will therefore be triggering to people with IBS. Number 12. Fatigue. Some recent studies have shown that individuals with IBS generally reported less stamina in their activities and poor sleep quality. IBS and fatigue often go together. The reason why is not established clearly, but they go together. Dealing with one of them regularly can be a challenge, but dealing with both at the same time can be overwhelming. Number 13. Anxiety. There is a link between mental disorders and physical disorders. It has been observed that most people with IBS reported feeling more anxious when hit with a symptom. Some believe that anxiety affects the nervous system and causes IBS, while others think the contrary. The relationship between the two is a vicious cycle since the presence of one only reinforces the other. Number 14. Mucus in your stools. For people with irritable bowel syndrome, the unexpected presence of mucus in their stool might be concerning. The presence of mucus in the stool is a typical symptom of IBS. It appears on the National Institute of Health's short list of IBS symptoms. Other causes could be lactose intolerance, celiac disease, or Crohn's disease. Number 15. Incomplete bowel movements. Individuals with IBS experience, in some cases, incomplete evacuations of bowel movements. It means that when you are done defecating, you still feel the need to evacuate even though your bowel is empty. It might seem like nothing, but it gets annoying when you have to go to the bathroom 5 to 6 times only to realize that you never actually went. Number 16. Sexual dysfunction. Research shows that there is a correlated link between men with IBS and erectile dysfunction. An individual with IBS is at a higher risk of having sexual dysfunctions. We assume that when someone is experiencing IBS symptoms like stress or anxiety, it can affect their sex drive. The take here would be that if you ever experience sexual dysfunction for no apparent reason, IBS might be worth looking into. Number 17. Nausea. Nausea in individuals with IBS is often observed with other symptoms like feeling full, abdominal pain, or bloating. While not always the case, nausea can be caused by a chain reaction ignited by irritable bowel syndrome. Number 18. Shortness of breath. When we experience abdominal bloating, the abdomen presses against the diaphragm, thereby inhibiting its movement and making it harder to breathe. If you experience shortness of breath, it might be wise to go to your doctor, as it can be a serious condition. Number 19. Dry skin. Poor digestion can have a strong effect on many bodily processes, and one very subtle aspect of it is skin issues. Many nutrients are wasted when someone has diarrhea, and some are necessary for skin nourishment. That leaves the skin dry and malnourished. Number 20. Spots and blemishes. IBS can sometimes cause skin spots, particularly if the experienced symptom is constipation. The non-evacuated waste represents a bulky annoyance for the body. The body in turn gets ingenious and finds other ways to evacuate all the remaining toxins and waste. Do these symptoms sound familiar? Have you experienced any of them? Let us know in the comments below. Here are 2 more videos you might find interesting. Feel free to choose the one you like. If you enjoyed this video, give it a like and share the video with your friends. And for more interesting videos on health, subscribe to the channel.